Uh, Thank you, Matthew, very much for getting us sorted out, and thanks everybody for your patience as we handled a couple of little tech issues. I'm Sheila Woody, and I thought I would chair this meeting, even though I'm not going first. I'm a professor of psychology at University of British Columbia. In fact, we're all at University of British Columbia. Panelists, would you like to introduce yourselves? Shall I let you do that? And then Priyam is going to speak first.
Hi, everybody. Oh, I'm sorry, you can go first.
I'm Christiana Bratiotis, and I'm an associate professor in the School of Social Work at UBC. And I'm joining today from the traditional, ancestral, and unceded territories of the Musqueam people, where I live and work. And I'm a guest on these lands, and I'm grateful to be joining you today from this place.
Hi, everybody. My name is Priyam Joshi. My pronouns are she, her. I just graduated from UBC this year with a degree in psychology, and I'm going to be an incoming Master's of Public Health and Community Psychology doctoral student at Georgia State University this year, and I'm really excited to be here.
Everyone, my name is Nancy Lynn. I'm a Master's of Social Work, practicing in healthcare. And as of fall 2021, I'll be Dr. Bratiotis' doctoral student, which is why I'm here, and very happy to be here.
Would you like to begin, Priyam?
Okay. Hello, everybody again. So my name is Priyam Joshi, like I said, and today I'm going to be talking with you about hoarding disorder in India. So I was born and brought up in India, where my mother is a clinical psychologist. So I was able to get insight into the mental health field at an earlier age. And so I have a lot of people that I know back in India who are mental health professionals. I graduated this year from UBC, where I worked at the Center for Collaborative Research on Hoarding. And while I was working at the center, I noticed that a lot of research that I was reading about was confined to Western countries. Additionally, on further reflection, I realized that when I would be talking to my mom about her clinical cases, or even when I interned in some local psychiatric hospitals in India, I'd never come across hoarding. And I was just curious to find out why that was the case. Furthermore, I also wanted to know if there were certain Indian cultural factors that at least I grew up with. I was curious to see if they had any impact on the identification, treatment, or expression of hoarding in India. So I visited my family back home in December for a bit, and I decided to take the opportunity to find out more about this topic. So I tried to look for published literature on hoarding disorder in India, and not very surprisingly, I didn't find a lot. And the papers that are out there are mostly about the prevalence of hoarding disorder. These studies have found that the prevalence is a little bit lower compared to the world literature. And this might be because there's just a little bit of scarcity of mental health resources in India in general, but there's also a lack of awareness of hoarding as an illness. So people don't really present it as a problem. So even in these studies, most clients were identified through other comorbid disorders. Next, I looked for perspectives of hoarding in the media and in the news. And again, I didn't really find a lot. And the ones that I did find were pretty inaccurate. They're well-intentioned, they're scarce, and they're also mostly inaccurate. So after I found all of these resources, I developed a list of semi-structured interview questions. And then I identified people in my personal and professional network who I thought might have experience treating hoarding. So I reached out to them and I interviewed them via phone or email. And I had the opportunity to ask follow-up questions and engage in really fruitful discussions about the impact of Indian culture on hoarding in their career. So I collected data in 2 stages. Initially, I only collected data to present it to my lab, but after I knew I was going to be presenting it here, I collected a little bit more data over the summer. Then I hand coded this data into different themes, which I'll talk to you about now. So my first question is usually about how many cases they've seen on average, and this would be about 3 to 4 cases on average per interviewee. And these cases were mostly identified through comorbid disorders or other problems like depression, family conflicts, or as one client said, an addiction to saving things. These clients were assessed using the DSM-5 criteria and very detailed family and self-reports, but never any photos or any pictorial evidence. Additionally, a common component when families would bring a client to the attention of a mental health professional, they'd complain about dirtiness, pests, stinks, or smell way more than they'd complain about the amount of stuff. Next, I asked about the impact on the individual, and the most common answer was depressive symptoms. And these seem to be tied to family and relationship conflicts and feelings of low autonomy and independence. So in India, it is the norm, usually at least where I grew up, to live in joint families with your grandparents or your uncles, aunts, etc. And especially the older members have a lot of control over what you're doing and how you're living. So if a client is hoarding, family members might force them to clean up regularly, and this might make the client feel like they don't have independence in their own home, which can lead to depression. There were also reports of malnourishment and hygiene issues, which seem to be more tied to the depression rather than hoarding. And at a more rare level, there were some reports of homelessness, and this might be because renting isn't as common where I live, so landlords don't cause evictions. And also family members aren't very likely to kick out a client because they think that it might reflect badly on them. Next, I asked about the impact on the family. So India is a very collectivistic country. And if one of the family members is burdened, the other family members feel the burden as well. So in one of the examples, one of the mothers was asked why she was forcing her son to clean up, even though it was causing him a lot of pain. And she said, watching him cry makes us cry, but we can't let him live in that dump. So for her, taking care of her son meant giving him a clean space to eat, sleep, and live in, but she wasn't able to understand that throwing away his items was actually causing him a lot of distress. Additionally, the impact on the family is also influenced by the gender and age of the client. So for example, if it would be a younger client, the family would talk about how they're not really respecting them and that they're not really using their school fees because they have a weakening academic performance. Or if it was an older female member, they talk about how they're not contributing to cooking anymore, or they're not helping raise the kids, and so on. There was also a financial burden felt by some of the families. So in India, daily cleaning is pretty affordable for middle class and upper middle class families, and it's often necessary to do it to prevent diseases because it can get very dusty. So for example, I lived in an apartment and 4 to 5 cleaners would take care of the whole building, and it's very affordable. They come a few times a week, but if a client is hoarding, those cleaners don't want to come and help anymore. So the families have to get the more expensive cleaners to come in every day, which can be pretty burdensome for the family financially. And lastly, a pretty common component in all of the families' complaints would be distressing over the fact that people will find out, that people will say bad things about them, just the general component of what will people say. This seems to cause a lot of stress to the families. As for impact on the community, there doesn't seem to be a lot of data. When I asked my interviewees, they said they guessed that there were some pest infestations and structural damage, but these are issues that are pretty common in India, even without hoarding present. And other than that, there's no official data and there's no reports about fires related to hoarding. Even though I'm pretty sure that they are present, there's just no data collected. So moving on to treatment, the main thing that mental health professionals do is family psychoeducation. So like the psychologist said, educating the family can shift the blame from the patient and initiate compassion from the family members. This has led to big changes, especially in the depressive symptoms, as the client feels more supported and less isolated. Some mental health professionals also practice CBD and EMDR. Sometimes they prescribe anti-obsessive medications, and monitoring is done by assessing insight, functional capacity, and family reports. Again, there's no home visits and no photos taken, and this is because there's not that many mental health resources. As one psychiatrist put it, the sad truth is we just lack the capacity to treat and research hoarding. There are worse mental health issues that need to be addressed first. The family also plays a pretty big role in the treatment of the client. So they definitely can be an excellent source of support for the client if they are given proper psychoeducation. Additionally, they seem to help prevent a lot of physical health hazards like pest diseases or falls in the house, or just generally physical health hazards like that. But again, even though it's not their intention, they can cause a lot of stress to the client by being pretty controlling. So to give you an example, one psychiatrist told me about how a grandmother would check her grandson's bags before he entered the house. She prohibited him from having a lock on his door and would send the house cleaner inside his room to clean every day. And obviously this led to a lot of fights, and they compromised by allowing the grandson to collect and store materials in one corner of his room as long as it did not stink. So as you can see, they can be a pretty good source of support, but again, they can also cause a lot of stress to the client. So now moving on to just a bit of discussion of some cultural factors that might have an impact. Before I talk to you about this, I just wanted to say that this is based on my views and my experiences while growing up, and they're not generalizable to everyone else. So there is a lot of sexism in India and a lot of gender imbalance. And at least within my interviewee pool, women seem to be diagnosed with hoarding much more than men do. And even when there were issues with hoarding present, they seem to be centered in the kitchen with food and utensils, or kids' toys and clothing items. So one psychologist told me that she thought that in traditional joint families, females tend to have deep-seated insecurities about their self-image, where they fit, and what belongs to them in their house. So the most control they have is in the kitchen, and so they feel reluctant to throw away those items, even with rotting food or broken utensils that might not be useful to them anymore. Then there's also some beliefs about savings. So a lot of previous generations of Indians grew up in times of scarcity, and they didn't have the abundance that we have today. So they kept saving, valued everything, and threw nothing. So in India, being thrifty and a good saver can be seen as a big virtue. I thought there was a connection with why this was mentioned and the fact that most complaints seem to be centered around dirtiness and stink or smells. I think it's because families tend to see hoarding as an issue when that component gets involved, rather than just amount of stuff. I think if it's just stuff, a lot of them see it as an organization issue rather than something that needs to be brought to attention. And then I found this quote in one of the Accurate news articles. A professional organizer said that, "I believe as a culture, we have been hoarding for generations. A lot of this has got to do with our history, as invasion by foreign rulers ensured that we always held on to what we had. Thus, this hoarding culture has passed on to us over generations." I thought this was really interesting because I didn't put this together at first, but even reflecting on my own life, my grandfather grew up in Gandhinagar, which was very heavily influenced by Gandhian ideology, which was to boycott British goods. And around the time of India gaining independence, he told me that his books and clothes were burnt one day because they were British made. And I think if families have that kind of trauma of parting with their belongings in their history, they might have an inclination to hang on tight to whatever family heirlooms they have. And lastly, religion also seems to have an influence. So the most obvious influence that I noticed was that psychiatrists would tell me that when clients with psychosis had hoarding, they commonly cited reasons for hoarding related to God. So they'd say, "God is telling me to keep this," or I am an avatar of God, or that they'd collect things that reminded them of God, so newspaper clippings or even rocks which they thought had God's face on it. And secondly, we had some discussions about Diwali cleaning. So Diwali is the biggest Hindu festival. And during Diwali, there's a belief that the goddess of wealth and prosperity, goddess Lakshmi, comes into homes that are clean and well lit. So during this time, cleaning can be pretty fun, at least it was for me. So we'd clean with our families and everybody would get involved and there would be music and it would be pretty fun. Like this cartoon says, it was the only time of the year when even cleaning seems like a celebration. So it's possible that clients who are religious might be able to cope better with cleanups during this time. But it's also possible that if they're not cooperating with their family cleaning, it can be seen as being pretty disrespectful to God, to family, and to their guests. So lastly, I just wanted to say that this was very limited research. I interviewed about 13 to 14 people, and a lot of them didn't seem to remember since they'd only had 3 to 4 cases over decades-long careers. But even based on this limited research, it seems that hoarding isn't uncommon in India. However, treatment seeking for it is pretty rare. And this is because there's a general scarcity of mental health resources, but also because there's a lack of awareness of hoarding as an illness among mental health professionals and the general community. I think a lot of things about hoarding are pretty universal, but there's also some very interesting cultural differences that could play a pretty big role in early recognition and treatment of hoarding. Thank you for taking the time to listen to me today. And if you'd like to talk to me about anything else, my email is on the screen.
Thank you, Priyam. It's really interesting research. I just like to let people know if we're going to be saving the Q&A period until after all of the presentations are done. And if you have questions that you really want to pose to the presenters, I recommend that you put them in the Q&A so that they'll be fresh in your mind and you can then release them from your mind because they're in the Q&A, and then we'll use the Q&A to drive questioning after all of the presentations are over. I see there's lots of activity in the chat around people who were unable to access one of the other presentations, and it looks like access is now there. So we won't be offended if you go to the other presentation, and we're also delighted to have you stay here. Okay, so I'm going to be speaking next. Let's see if I can get my my screen sharing up here. Oops, that didn't work. Hold on, sorry. Okay. There we go. So I'm going to be talking about cleanouts today. This is some research that we've been doing that's funded by the Social Sciences and Humanities Research Council of Canada. Hoarding, as everybody in this meeting knows, hoarding is a really complex problem. And we have a long way to go toward understanding how to treat hoarding from a mental health perspective, and also how to help people stay safe, even if they don't want treatment or they don't want any other kind of assistance. So we're going to be looking at one of those ways that has many pros and cons to it today. So what do I mean about clean out? By clean out, I'm referring to a fairly rapid removal of a large amount of material, often involving a team. And the way we're thinking about it is clean out is, the line between decluttering and clean out can be a kind of fuzzy one. Clean out is sometimes a difficult topic to discuss. Service providers, when we've interviewed them about clean outs, they are quite uncomfortable to talk about it, and they initially say they don't do it, and then Then if we press them, then they'll talk about clean out practices. Clients might feel triggered. So this conversation, if you've experienced a clean out, might be a little triggering for you. So I encourage you to take care of yourself, take breaks when you need to. Researchers generally steer clear of this topic. Our research is focused on the kinds of cleanouts that are undertaken by authorities. So they're usually forced or coerced, in which the person has kind of a constrained choice, like, okay, we don't have to do a cleanout, but then you'll be evicted. So that's a terrible choice. We've started working on this topic because it's so taboo, because there's a sense that cleanouts shouldn't be used. Service providers, researchers, clients, everybody thinks that, but there's not a lot of research, and we know that they actually are being used. So we thought it was really important to start doing research. So what kinds of things lead to a cleanout? We know that there's going to be some kind of time pressure to make big changes in a short period of time. That's what cleanouts are about, is making a big change in a short period of time. Where does that time pressure come from? There's several sources of threats that would create time pressure. So one might be some health threats. There might be pest infestations that are affecting neighbors or health. There might be a big change in health status, like the person has gone into hospital and now needs to come home with some home health care. And those in-home healthcare needs may not be able to be met without some sort of major change in conditions in the home. There's also safety risks that can give rise to a need to create rapid change in the home. Fire risks, concerns about maintenance, like maybe water leaks or something like that, or risks of falls or entrapment for vulnerable residents in the home. We're very aware of eviction threats as something that sometimes drives a cleanout, and those often represent a confluence between health concerns and safety concerns, and it's something that can lead to homelessness. So as researchers, we normally go right to the research literature to try to find out what's known about a particular topic. But in the case of strategies that community service providers are using for hoarding, what they're trying to accomplish and what kinds of goals they're trying to achieve, the academic research just doesn't actually have very much. So we undertook a broad review that went well beyond the scholarly literature. We read the summaries or the titles and abstracts for 814 papers, and then full text of 292. We included in our broad review 143 papers, but only 84 of those addressed cleanouts. And so those are the ones I'm going to be talking to you about today, what we found in those 84 unique documents. They included things like housing guidelines, task force newsletters, clinicians toolkits. We were particularly interested in what's the rationale for a cleanout? What are the practices that are used? And then also, what attitudes do we see around outcomes? Because there aren't systematic data around outcomes, but what do people think the outcomes are? We really wanted to understand how are cleanouts being used, because there just isn't much literature on it, and we know they're happening. So we first started by looking at what are synonyms for cleanouts. And here on this slide, you can see a bunch of the synonyms that we saw in the literature. I was kind of interested that a lot of these use the word clean when cleaning isn't really part of the story with a cleanout. If there's going to be some actual cleaning, that would be a separate step once there's space to do so. Turning to the attitudes about cleanout outcomes. The most common attitude that we saw is to note the high emotional toll on the client. And I think this leads to the taboo around talking about or doing research on cleanouts, because this is an undeniable cost that nobody actually likes. So I'll give you an example of a quote around this. This came from Community Options 2016. This was a paper from Ontario, Ottawa, on cleanouts, about hoarding interventions broadly. However, it should be recognized that due to the complexities of hoarding, Removal of the items without support being in place for the client will not necessarily resolve the situation in the longer term, as they may begin hoarding again. And an enforced large-scale cleanup could cause extreme anxiety to the tenant. So the next attitude about clean out outcomes that we saw in the literature was that people believe that it would inhibit future help seeking due to now distrust of service providers. So the client now says, I want to just not ever open my door to anybody who might be a service provider because I know what they might do. They might do that clean out thing again. And so this is a long-term bad outcome. Another outcome that we saw being discussed in this literature was high costs, and then accompanied by with little long-term gain. One document referred to it as a waste of money. The cost is kind of a weird thing, though, because some agencies, it's easier for them to get funding for a clean out than it is for them to get funding for in-home decluttering support or for case management, some of these more client-centered approaches. So they're stuck between a little bit of a rock and a hard place because they can get funding for the thing they don't want to do, but they can't get funding for the thing they do want to do. Another belief we saw about outcomes is that there's a rapid return of hoarded conditions. You saw that in the quote I gave you earlier, and I'll give you another one right now. This is from the development of a hoarding response plan out of Ann Arbor, Michigan in 2016. The approach of cleaning or clearing out is not a viable solution, and it is painfully ineffective, which more than likely will intensify the hoarding disorder behavior beyond its original presentation or problem. Finally, as researchers, we were very interested in outcomes of whether the goals of the clean out had been met. And we found almost no discussion in all of those documents, the 84 documents that we looked at on cleanouts, of whether the goals were met. So was tenancy preserved? Was the person able to have egress from the home in case of emergency? Those kinds of goals, there was no discussion about whether those goals were met. So that's obviously a big gap in the literature. So now I'll talk about some of the practices that we observed in our scoping review. I'll talk about client welfare and some other aspects of practices. So most of the research articles that we have describe what a clean out is, and they say that it doesn't address the problem. When we looked in these 84 different documents, we found a lot of ideas for how to improve the client's experience, and we think this information should be better known. So one really key thing was ways to protect the client's privacy. And I'll just, if you're not really familiar with how cleanouts can go, I'll just give you an example. So imagine having this scene happen outside your home, and how mortifying it would be that your neighbors were able to see this kind of scene happening. So taking steps to protect the client's privacy by not being quite so obvious with what's going on in the home is an important thing that we saw in some of the documents. Lots of the documents talked about client consent and ideally finding a way to get the client's buy-in. Sometimes this is not possible, but that is the best outcome, is when the client can consent. Another thing that is important for managing the client's experience is to coordinate the different participants. So I mentioned before that a clean out might involve a team of people. Sometimes that team is well known to the client. Like, for example, if a clean out occurs in the context of later stages of CBT for hoarding, for example, it might be the treatment team itself that has come into the home invited by the client to engage in a clean out. But in the kinds of cleanouts that I'm talking about that happen in communities, it tends to be participants who are part of the cleanout. The clients never met them, and they come from different disciplines and they have different focus. So someone needs to be the person who's coordinating those different participants and communicating directly with the client so that there's not so much coming at the client, because it's a pretty overwhelming day. Another important thing that we observed in these documents about cleanouts is how to identify and use the client's natural supports. And by natural supports, we mean their family, their friends, their faith community, social organizations that they might belong to. So so many of the documents that we saw around cleanouts would identify these natural supports and have them be part of the cleanout team, because then they're able to, they know this person, and then that is a better experience for the client. Including mental health support is not always done, but certainly the documents that we saw on cleanouts mentioned that. It's also not always available, depending upon the community that you're in. So these are some of the things that we saw mentioned in our documents around client welfare. Next, I'm going to talk about the different roles of participants in a cleanout. And here I'm referring to the client as a participant as well. So who's going to undertake these different roles? So one important thing is there's decisions that will be made. There's the decision about to have a clean out, but there's also decisions about what's going to stay, what's going to go, what are going to be the boundaries of the clean out, what's out of bounds, and what is part of the clean out. So it needs to be determined which ones of those decisions are going to be made by the client and which ones will be made by the cleanup crew. So I'll give you an example of, oops, sorry, I'm going the wrong direction there. So here's an example in which the client is making almost all of the decisions. So in this one from Bratiotis and her colleagues in 2011. So the therapist asked Roger, that's the client, to determine how to categorize items that would be sorted into piles of keep, donate, and discard, and then locations for those items to be kept. So that's what Roger's deciding. The team would then sort the possessions according to Roger's system, organize those items Roger wanted to keep, and remove from his property those that Roger chose to discard. So you can see this example, the client is making almost all the decisions. He just has help implementing those decisions from the team. That kind of setup can really only occur within the context of mental health treatment. And so that's unlikely to characterize most of the community initiated cleanouts, because that setup is not available in most cases, and the client's not interested in treatment or intervention of any kind in many cases. So that this arrangement isn't an option. This is from a 2006 Ottawa community report on hoarding. And it's an example of how to help the client be involved even when the situation doesn't allow for much client decision making. So they're recommending encourage the client to participate even during a major cleanout. Get them involved so they can be part of the process and have some level of control. Ask them if you can help find something they might be looking for, or give them a box to help sort through, just so that the client can be part of the process. Okay, so that was around decision making. We also saw a discussion of a role of removal, who is physically removing the belongings. As I mentioned earlier, some of these documents talked about recruiting volunteers from within the client's natural supports, but others talked about hiring professional organizers. Family members are also sometimes involved in removal, or the family might hire a cleaning company. Family members can be involved in a constructive way, but we also saw quite a lot of mention of family members being involved in a destructive way by, say, the client goes on vacation unsuspecting, and the family members take a unilateral decision to do a clean out of their home. And so we saw some mention of that as well. In terms of who does the removal, I think I mentioned all of these. Oh, the one I didn't mention was some cities or municipalities have a removals team or a city cleaning unit. And so some places will use that. The thing is, we don't actually know how common any of these strategies is. So that's something that research needs to determine. Another factor is who's going to pay. So sometimes the resident pays, sometimes the community pays, like when there's say a municipal team that pays, sometimes the landlord pays. And then after the clean out, support during the clean out and then after the clean out. And after the clean out, there are some other activities that need to be undertaken, like actual cleaning or organizing the materials that are left or making repairs to the home. So these are some of the roles that we saw being listed in documents about cleanouts. We also saw some mention of worker welfare, not very many. There were just a couple, though, talking about worker welfare. Some of that was around occupational health and safety because of biohazards that sometimes happen with homes that also have squalor in addition to hoarding. But also it's very stressful for workers if they're going to be doing a clean out and the resident is very upset and doesn't want this to be happening. That's also stressful for the workers. So there was some acknowledgement of that, although, as I said, it was not common. I want to talk for a moment here about clean out practices around planning that Michael Tompkins talks about in his book. In addition to some of the things that we've already talked about, like setting up participant roles, he suggests considering some of these topics for planning. One is defining the scope and the boundaries and the time frame of the clean out. Another is really thinking through what kinds of things you're going to do to maximize client welfare and help support the client. What's going to happen if the client doesn't consent? Are there going to be legal mechanisms that need to be put in place? Or what if the client withdraws consent in the middle? How is that going to go? What are the safety protocols for the client, for the workers? How are you going to safeguard valuables? Client's jewelry that her mother gave her. How are you going to identify that and put it in a place where it stays safe, despite there being a lot of people in the home? What are you going to do with animals, pets, or animals that may be in a hoarding situation? If it's going to take a few days to undertake this clean out, is there someplace the client can stay? And then what are the details around the hauling and disposal? I put that last, even though many service providers may only think of that one. People might think, oh, this is what a clean out is. That's what I need to think about. But actually, we think all these other things need to be considered first. That's kind of the last thing. This scoping review has told us a lot about what community agencies are thinking about. But that might not reflect what actually is happening in practice. We don't know. This is what they aspire to, perhaps, or maybe this is what they're actually doing. To understand what community agencies are doing around cleanouts, we have just launched 2 studies to interview providers and clients about how cleanouts actually unfold. So we're looking for frontline professionals who have conducted cleanouts within the last 3 years, or clients who have experienced a clean out within the last 3 years. If you would like to help us with our research, we invite you to come for an interview about your clean out experience so we can better understand what kinds of practices are being undertaken and what are the impacts of those practices. There's some information on the slide here. If you're interested, just send us an email and we'll start going down the process of the research. Thank you very much. Okay, so next up, we're going to have Nancy and Christiana are going to jointly do a presentation. Is it Christiana who's starting? Yes. Nope, it's Nancy who's starting. Great. Nancy, take it away for us.
I'm actually starting. Nancy was sharing slides. Good afternoon. I'm Christiana Bratiotis, as introduced earlier, and today I'm going to be talking with you about hoarding intervention in affordable housing as a community-based intervention, and specifically focusing on the commitment of one large affordable housing provider to safety, health, and quality of life. And I'm really delighted today, for the first time as a doctoral student working with me, Nancy will be presenting in just a few moments. Next slide. So I'd like to tell you a little bit about Beacon Communities. They are a large affordable housing provider in the Northeast and Mid-Atlantic parts of the United States. They have been recognized for their deep commitment to building safety as well as resident services. They're considered a leader in offering multifamily affordable housing. In addition to being an affordable housing provider, they also provide housing to those with disabilities in their portfolio, to seniors, and market rate housing. Here's a few photos of some of the properties in Beacon's portfolio in the Northeast of the US. Next slide. Tragically, in 2010, Beacon experienced probably one of the worst feared events for a housing provider, and that is that they had a fire at one of their properties. And this was a hoarding-related fire. Thankfully, no one was physically harmed in that, but there was a great deal of property damage. And as a result, Beacon as a corporation came forward and said, we have to prioritize this issue of hoarding and how it impacts our buildings, our residents, and our staff. And so following from that fire, they established a hoarding policy and later an intervention protocol. And that protocol has now been in effect for about 10 years of time, and it's universally adopted across all Beacon properties. The point of that protocol and the policies associated is really to maintain safety and meet regulatory standards. There are very high inspection standards, especially for affordable housing providers. So they do that while in any way possible preserving the tenancy of those that live on their properties. Next slide. So we were very fortunate as the research team from the UBC Center for Collaborative Research on Hoarding to partner with Beacon Communities. They welcomed us into their properties. We had the opportunity through site visits, interviews with executives and administrators and the leadership team, as well as talking with frontline staff to really familiarize ourselves with this protocol and policy. We worked very closely with the resident services leadership team. And in fact, we met with them weekly for nearly 2 years of time while we were collecting data, both through site visits and receiving archival data. Our primary aim in this partnership was to understand what Beacon was doing to address problems associated with hoarding in densely populated affordable housing buildings. Next slide. I want to talk with you today, and Nancy's going to take it over in just a few minutes, about an interview study. This was part of the work that we did with Beacon Communities, and I was very fortunate to collect the data in this study with our colleague Kate Kaiso. We had the chance to travel to several Beacon properties in May of 2017. We conducted 24 staff member interviews at 7 properties. We talked with 5 property managers, 8 resident service coordinators, and 11 maintenance staff. The interview protocol really was designed to explore how the protocol for hoarding Beacon, as well as their policies, are being implemented and carried out. We used a semi-structured interview format to understand the experiences and perceptions of the staff. And is this thing working? How easy is it to implement? How is it impacting the residents? What changes is it leading to? What are the pitfalls, the challenges, and the opportunities for an affordable housing provider to implement such a policy? We gained both a general understanding of what was happening at Beacon Communities, but we also then learned quite a lot about some of the pressures that are facing affordable housing providers in general as related to hoarding, some of which we hope will be helpful to other affordable housing providers as we disseminate these findings. Next slide. Just say briefly, after conducting these 24 interviews, we had piles and piles of transcripts of data, and we took a very close look at that data using 2 qualitative analysis methods. One, we conducted first a content analysis where we identified 11 primary themes that characterize these 24 interviews. And then I conducted a narrative analysis, really looking for the stories that Beacon was telling us about how it is that they engage with their protocol and policies specific to hoarding. And now Nancy will share with you those findings, both that reflect both the content analysis and the narrative analysis.
Right, so coming out of our analysis, we summarized our findings into 3 sort of overarching 3 key themes. The first was the unique Beacon story. The second was their commitment to safety. And the third was the centrality of their resident service coordinator roles. Starting with the unique Beacon story, now many of the staff at Beacon talked about their aim not just to provide housing that was affordable, safe, and clean, but really the endeavor to create a sense of home and sense of community for all of their residents. A property manager said, they, the residents, like living here. They know their neighbors, it's comfortable, it's a family community. One of the things that made Beacon so exceptional was their ability to meet the diverse psychosocial needs of the residents that lived in their buildings. The resident services department at Beacon provided all sorts of supports, ranging from on-site programming to making community referrals to increase and enhance the physical and mental health well-being of their residents. Resident service coordinator said, I'm just here to provide the service for them and let them know here's what's out in the community and how I can be of help to them. Beacon had a very unique story as it relates to hoarding, and that story really begins with their forthright acknowledgement of the fact that, first of all, hoarding actually happens in their buildings, and second, that this sort of behavior has had very devastating consequences. Significantly, Beacon constructed the problem as hoarding as a mental illness rather than as a moral failing. And this allowed them to promote a really compassionate response that was focused on the well-being of their residents. And the reason why this is so significant is because in our experience, hoarding is often a problem that organizations will deny, they might minimize, or they might turf onto others because it is such a complex issue and also because of the societal stigma associated. This creation of an organizational culture that was really centered around safety and compassion wasn't something that was accidental, but really the product of a very intentional and systematic allocation of fiscal personnel and programmatic resources. repeatedly, what our research team heard was that resident and community safety really was the foremost top priority on the staff members' minds. And this was the primary way of thinking about and conceptualizing hoarding at Beacon. My main concern is everyone's safety, because we have 276 units, we have a lot of families in here. For us to be on top of, the hoarding situation and whatnot, because it doesn't just affect one person, it starts affecting other folks as well. As Dr. Bratiotis has already detailed, in 2010, Beacon experienced a very devastating fire. And it was this incident that really awakened the organization to the risks associated with hoarding and created a sense of urgency that then really compelled them to allow for this resource allocation. And this looked like further training, further capacity building, and of course, their portfolio-wide hoarding protocol. The hoarding protocol was developed by the resident services leadership in conjunction with in-house staff, in-house counsel, community researchers, as well as local human service providers. And the implementation of the protocol involved direct leadership to staff, training, communications, as well as a real encouragement for staff to participate in regional hoarding task forces, so that they could enhance their understanding of hoarding as a problem, of hoarding as a mental illness, and also their knowledge of what the local community resources were. The Beacon Accommodation Action Plan is something that's really important for us to highlight because it is a very central part of the protocol. The accommodation plan was developed to address hoarding in a very supportive manner, and really with the goal of deferring punitive actions like issuing fines, threatening evictions, or issuing letters of lease violations. Tenants will jointly craft the action plan together with a resident service coordinator, and these plans will often include the timelines for which goals should be achieved, the frequency at which the home might be visited to check for progress, the sorts of community agencies the person will be referred to, and of course, the very specific tasks that are meant to mitigate risk. So a resident service coordinator said, I think that sitting down with the resident and having that conversation, creating that accommodation plan, reviewing pictures, saying, this is what my plan is. And if this doesn't work out, then maybe we have to go to court. But that's not going to be our first go-to. At Beacon Communities, like all other affordable housing providers in the United States, regularly scheduled inspections are mandated by their funding agencies. And funding, by proxy, the ability to continue to provide affordable housing is tied to the outcomes of those inspections. Legitimately entering a residence unit through the inspection process was the primary mechanism for identifying hoarding at Beacon. Particularly for cases that otherwise might have gone unnoticed. And this might be because residents who hoard don't necessarily submit requests for maintenance or general upkeep because they are aware of the condition of their home, they're concerned about the associated stigma with it, and they also might fear retributions or fear of sanctions. So one of the participants said, through inspections, you're in there now and you actually get to see apartments that normally residents don't call in. Now, in terms of the inspection process, that generally is conducted either by maintenance staff alone or a combination of maintenance staff plus property manager or maintenance staff plus a resident service coordinator. Now, although inspections were the primary way of identifying hoarding, work orders, i.e. maintenance requests, and pest management were two other ways to identify hoarding. Maintenance staff are granted permission to enter into a unit when the resident requests some kind of service from them. And during these visits, maintenance staff are able to visually assess any safety risks and then communicate that to the resident service coordinator. with the pest management services regularly scheduled and emergency visits also create another legitimate reason for entering into a unit. And likewise, when they notice any risk factors, they will either note it down in their official written reports or provide a verbal handover or heads up to the resident service coordinator. So, for example, when the pest management company comes out to do the biweekly in that particular unit with the gentleman, there's a maintenance tech that goes with them. So the pest management company are our second eyes. It's a team effort. Resident service coordinators were characterized as central figures in the hoarding response at Beacon. And this was a role that was prioritized by Beacon leadership through the provision of sustained funding. The resident service coordinators led the implementation of the protocol, starting, of course, with co-conducting the inspections and then meeting with the residents to create an action plan. And when the resident service coordinators that we spoke to reflected on the process of creating that action plan, what they really wanted to emphasize was the importance of a collaborative and a supportive approach. So one of them said, we tell them, we're here to help you. We're not trying to make your life difficult. We're just here to help you. And through the process of implementing the protocol, the resident services coordinators will often do a variety of functions such as crisis intervention, client advocacy, as well as service linkage. And interestingly, the resident service coordinators describe their role in hoarding interventions as really sitting at that intersection of carrot and stick. So good cop, bad cop. In buildings where there was strong property manager presence, the property manager would often act as the bad cop, the enforcer. But in buildings where that just wasn't available, the resident service coordinator had to balance and juggle both of those roles, which was very difficult. Now, given the nature of resident service coordinator work as relating closely to the socio-emotional needs of their clients, it's not very surprising that many of them formed really solid interpersonal relationships with the people that they served. The people who held resident service coordinator roles often reflected something of the communities that they worked in, either identifying culturally or identifying from a socioeconomic standpoint. One resident service coordinator said, I think as a resident service coordinator, you have to fit in with your site. Your residents can't look at you as an outsider because they won't relate to you. They'll either be afraid to approach you or they just won't like you based off of how you're dressed or how you speak. Now, although the conditions of a home might meet hoarding standards from a Euro-Western standpoint, from a different cultural lens, you can imagine that maybe it's a non-issue. And a very salient example of this worldview difference was explained to us by a resident service coordinator who worked in a building where predominantly the resident population identified as Haitian, and she herself identified as Haitian. She explained that it wasn't uncommon for her Haitian residents to accumulate large volumes of belongings, put them into Haitian barrels, and then send them back home to their loved ones. And despite this very significant accumulation in rather small spaces, the resident service coordinator reflected that I just felt like they knew I understood what the barrels were for and the fact that I was trying to work with them and be patient. For resident service coordinators who shared that cultural understanding, there was a sense of hesitancy or selling out one of their own when it came to reporting hoarding situations. And these tensions were exacerbated when resident service coordinators considered their role within the organizational structure. So how they conceptualized it for us was that you sort of have they sort of held a sort of central component of the circle, and the resident was one layer in and management was one layer out. So there really was this sense of being caught in the middle of sort of sometimes divergent needs from these other sides. The organizational expectation for resident service coordinators to ensure that residents complied with regulatory mandates also, of course, strained their relationships, particularly for folks who had been living in these buildings for a really, really long time in similar situations before the hoarding protocol had ever been put into place. So they've, longtime residents, been living that way for many, many years without anybody saying anything. And then here I come and it's like, oh, that new girl, she has it in for me. Now moving on to discussion. In terms of practice implications, the resident service coordinator model used by Beacon evidently has been very successful for them. And therefore, we believe that it should be considered for adoption by other affordable housing providers as well. And given that the relationship between the resident service coordinator and the resident is so paramount and so important to successful intervention and for ongoing compliance, we also recommend that there is a very clear division between the carrot and the stick role. Carrots are the people who are in the unit, sort of interfacing with the client on a day-to-day basis. And these folks should be supported to maintain their rapport. And so carrots should stay carrots. Whereas people who might hold more of the stick or enforcer role should be people who are more, might be a little bit more removed from the day-to-day goings-on of a client. So people in property management or other leadership positions. And the institutionalization, the creation of Beacon's protocol really also allowed for a very desirable kind of standardization, which then supports replicability across cases. Of course, it's also important to acknowledge that a case-by-case basis where you can sort of be more flexible to the nuanced situations of individual client cases is also great, but that flexibility really should still take place within the sort of framework of a standard protocol. In terms of policy implications, Beacon's success with resourcing the resident service coordinator role should be treated as a call to action for other housing providers to fund similar roles. This includes funding for the RSCs to have what they need for hoarding interventions, but also for other supports like decluttering and sorting services and clinical treatments such as psychotherapy. Beacon has prioritized having a dual focus on the building residents as a whole and individual residents. And being able to see and balance the value of both of these perspectives does allow for a more comprehensive and holistic approach to addressing the issue. And with a focus on safety, providers should use inspections and regulatory mandates as the conduits for achieving compliance, and also as a harm reduction strategy. And finally, housing provider staff should have access to training to enhance their assessment skills, to enhance their intervention skills, to enhance their sensitivity to hoarding as a mental illness, as well as to achieve some awareness of cultural sensitivity as well. And this training really needs to occur in the context of a sort of forum where people can have ongoing discussions with other folks and practice skills so that this education isn't just sort of being received in a vacuum. And finally, the next steps for our research team, we will be publishing a manuscript based off of this particular study, which will, of course, allow for scholarly dissemination, but of course, we will also be sharing the manuscript with the folks at Beacon so that they can share it within the organization as well. We will continue to conduct research looking at hoarding in housing, in particular social housing, and we do have a present relationship with Lookout Housing in Vancouver, British Columbia. And finally, our research team is presently engaged in another study further exploring hoarding providers' perspectives, where we are looking at the attitudes of providers more broadly, including folks who work in sectors such as mental health. That's it. Thank you very much.
Thank you very much, Nancy. I just wanted to hop on pardon my interruption. We have 5 minutes left, but we can run through a few of the questions in the Q&A. So if the faculty want to pull that up and run through a few, we can spend some time on that. Thank you.
Sure. Let me, I'll send this first one perhaps to Christiana. I think you're the best person to be able to address this question. Is there any comprehensive repertoire of cities, county, state hoarding task forces in the US? Any sorry, it keeps slipping away from me. Any federal, state regulations, supervising authority, resources, protocol, anything about how to establish a task force? Obviously, wanting some hints about how to move forward there.
Yeah, thank you for the question. There is no such universal kind of repository for this information. And part of the reason when I started my research in the area of community responses to hoarding back in 2004, there were about 4 community task forces in the US. And we now know that number is over hundreds across multiple continents around the world. And so it's a bit too unwieldy to try and keep hold of. What I would recommend is reaching out to the IOCDF. They're a wonderful resource. You're certainly welcome to contact us at the center and ask in your local area, state, region, community, part of the world if we know of anything. I can't guarantee that we do, but those 2 are starting places for just checking in about available resources. And this is a real call to action. I think if anyone has additional time and grant resources available, putting together and maintaining such a database, I think is sorely needed, but also comes with its challenges.
If I'll take this next question. Did your research give you a sense of where these cleanouts are more common? For example, cities without an infrastructure to address hoarding without cleanouts, rural areas versus cities, apartments versus standalone homes? That's a really good question. We don't know the answer to most of the subparts of your question, but the one thing that we did see is that it's a difference between renters and owners, or people who are living in single family homes as an owner. They enjoy much greater privacy protections and property rights. The cleanouts tended to happen more often in buildings that were multifamily dwellings. That's all I can say at the moment. Stay tuned. This question would be for Christiana and Nancy. Did Beacon's protocol bring in community agencies like fire departments? And if so, how and when did they do that?
Absolutely. The protocol accounted for collaboration with all kinds of community partners, some first responders as necessary, so code enforcement, fire when there was imminent risk in a situation related to the building, sometimes protective services for animals or older adults or children when there was imminent risk for the resident of the home. But they also collaborated with other community groups, older adult services, in particular, clean out companies as needed, restoration services, getting the donation of certain kinds of items from religious or other social groups in a community. And I think it's one thing that the individual resident service coordinators really took upon themselves was to learn about the resources in their particular community and then broker them, as Nancy was saying, on a case-by-case basis as needed.
Thank you, Christiana. And just a warning, probably time for one more. Don't want to cut you off, so probably just one more question.
Thank you, Matthew. So this one would also, I think, go to Christiana, but it's a really important question. Alex asks, can you please talk a bit more about what type of details, what is an accommodation plan that they had at Beacon? What does that mean?
So the accommodation plan at Beacon was based on the federal legislation in the United States under the Americans with Disability Act that ensures that all people with a disability, diagnosed or not, is able to receive accommodation for that disability. And that's a reasonable accommodation that is provided by housing providers. You can read about this by going to the federal legislation. You might also choose to go to masshousing.org or Metro Housing, Boston's website, where they both have information sheets posted about disability reasonable accommodations. That accommodation action plan at Beacon is their version of interpreting and being compliant with that federal legislation at its core, but then there's other things wrapped around that as well.
Terrific. Well, thank you so much. This was so incredibly informative and well done. And thank you to all the attendees who spent the afternoon with us. Apologies to anyone whose question has not been answered. You can always reach out to the IOCDF for more resources or look on the attendee resource page on the conference site to share contact information and to be able to connect. But thank you all so much. We hope that you'll move on to your next session as well and have a great rest of your day. Thank you so much.